When a person is put behind bars for an alleged crime, they may be feeling especially vulnerable.
What's probably going through their mind at that time is, are my kids safe? What's going to happen with my job? They towed my car. I had to pay my rent. There's a lot of pressure that people feel when they come into a system like this. And there's a shock, an incarceration shock that happens.
That's why Correctional Health Services and the Maricopa County Sheriff's Office created a three-pronged approach to prevent suicides in jails. First, CHS uses an enhanced assessment to determine if a patient is considering harming themselves or others. They also use that assessment to determine if the patient has withdrawal symptoms from alcohol or drug abuse.
On the CHS side, what we did is we added a suicide assessment in all of the interactions that we're having. So we have patients that are withdrawing from different substances. When they meet with a nurse twice a day, the nurse now begins to also ask the questions.
Secondly, MCSO notifies CHS if a patient they're bringing in is a suicide risk. And vice versa. If CHS has a patient in jail with potential to harm themselves, they notify MCSO immediately.
And one of the things that we have now recently in the last several years is tablets. So now when they log onto their tablets, there's actually a flyer that pops up that says you're not alone here. There's a whole team of people here that want to help you. If you're thinking of hurting yourself, reach out. Another area that MCSO is working with us is something called Court Call, which allows us to do groups with up to 90 people. So if they're in a classification where they're alone, what we want to do is have a chance to get into the cell with them. We can actually, through these tablets, interact just like we would on our Zoom calls.
Lastly, CHS is working with community partners to make a suicide prevention hotline available to patients while they're in jail.
We're in the process of working with two community entities to try to figure out if we can just join in a suicide hotline that's already in our community, or if we want to start this initiative on our own.
CHS and MCSO are hoping their three-pronged approach will let patients know that they are not alone. They are cared for, and help is available to them anytime, day or night.